Well, pain is something we all deal with at some point or another, but millions of Americans are suffering when they don't have to, especially when it comes to knee pain. The American Osteopathic Association found in a survey that almost 60% of Americans hesitate to tell doctors about chronic knee pain. And it's not just something for seniors to worry about. Close to 65% of Americans, 18 to 34, reported some kind of chronic pain in their knees. Well, now there's a new easy treatment that could possibly help, and joining us now to talk about it is Dr. Jeremy Coleman with UF Health, a sports medicine primary care doctor. You know all about all our joints.
Absolutely.
And everything that breaks.
Absolutely.
So tell us, knee pain is often the sign of something really bad that needs surgery, or it may not be, right?
It may not be. One of the most common conditions, such as osteoarthritis, affects millions of adults. And fortunately, science and medicine has advanced, so there are some great treatments. However, for some patients, there's still a gap there. Conservative treatments, such as Tylenol and anti-inflammatories, may be insufficient for some patients. And then a lot of patients may not be great surgical candidates or may not want surgery. So for those patients in that gap, iovera is something that they can explore.
And you don't necessarily know you're a candidate until you go to the doctor, but don't you think that a lot of people are afraid to go because they're worried they're going to get a diagnosis of you need surgery?
Well, I think you run into that in a number of situations, whether it's colon cancer screening, prostate cancer screening, even with knee osteoarthritis. So one thing is just to find out.
Okay, so this is called iovera. How does it work? What do you do?
And so with this small device here, we're able to target 2 sensory nerves around the knee. Once the cold therapy is introduced to that nerve, the pain signals that are transmitted to the brain basically tell the brain that there's no more pain. And so, as I mentioned, if conservative treatments are not effective and a patient does not want or cannot have surgery, this is a safer alternative to, say, chronic narcotics or some of the other interventions.
Well, and the no anesthesia is a big plus, too, because a lot of people are uncomfortable with that.
Absolutely. It's a quick in-office procedure, takes 20 to 30 minutes. The patient is awake, and instantly they have pain relief. And in my experience, on average, most people have 3 to 4 months of relief, but I've seen it as long as 9 months.
So it's instant. It almost seems like it's, you know, people get a cortisone shock to help them along just for a brief period of time, but this is not cortisone. This is something very different.
Yeah, so we're targeting nerves that are totally outside of the joint. Okay, so we aren't even introducing any medications or anything of that nature. And some patients may not find cortisone injections or even hyaluronic acid injections effective at some point. And so once again, that kind of falls under that umbrella of conservative treatments.
Definitely worth checking out, and we know there are so many people with knee pain out there. You're probably watching right now. Well, if you're missing any of those details, we'll be posting this whole segment to news4jax.com just a little bit later this morning. Just look under the videos tab on the morning show page. Thanks so much for being with us this morning.
Thank you for having me.